As member of the Commission to Study Environmentally Triggered Chronic Illness Data Subcommittee, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with the governor's emergency order number 12, pursuant to Executive Order 2020-04 and its extensions, this public body is authorized to meet electronically. Please note that there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. In accordance with the emergency order, I am confirming that 1, we are providing public access to the meeting by telephone with additional access possible by video and other electronic means. We are utilizing Zoom for this electronic meeting. All members of the committee and selected legislative staff have the ability to communicate contemporaneously in this meeting through this platform, and the public has access to contemporaneously watch and/or listen to the meeting on Zoom or YouTube and via phone by following the directions and links provided on the General Court website. Number 2, we have provided public notice of the necessary information for accessing the meeting in the Senate calendar. 3, we are providing a mechanism for the public to alert the public body during the meeting if there are problems with access. If anyone has a problem, please email remotesenate@leg.state.nh.us or call 603-271-3043. Number 4, in the event the public is unable to access the meeting, will be adjourned and rescheduled. Number 5, please note that all votes taken during this meeting shall be done by roll call vote. Finally, let's start the meeting by taking a roll call attendance. When each member states their presence, please also state where they are and if anyone else is in the room with you during this meeting, which is required under the right to know law. Let's see. I can call the roll and then we can have somebody else take over the meeting. The roll call here is based upon those who signed up. Representative Nancy Murphy here. I'm home in my home in Merrimack. A number of other people in the house, but nobody in this room. Dan Tizik, I believe, will be joining us in a short time. Amy Costello.
I'm here in my home office in Dover. There are other people in the house, but not in the room.
Thank you. Dr. Kathleen Bush.
Hi, yep, I'm here alone in my office in Concord, New Hampshire.
And Mindy Mesmer.
I'm here in my house in Rye by myself in my office.
Right, thank you.
Great, so I think I am the leader of today's meeting. I did send around an agenda early on. I do think one of the key pieces of business is to think about sort of long-term maintenance of this subgroup. So I don't know, let's see, I will try to share my screen here. Hopefully folks can now see sort of the suggested agenda items. I'll just review these quickly and we can think if there's anything else or if a different order makes sense. But one was to review the draft subcommittee report that we circulated a few weeks ago and then sent to Senator Sherman, but then at the last full SB 85 meeting decided not to include because it still needed some work. And so we'll review that and then discuss next steps related to the report. I also thought it would be useful to brainstorm some future presentations or testimony that might help move the commission work forward. And I've listed some examples of potential presentations here. And then I thought just to spend some time together thinking about next steps for this subcommittee. I feel like our charge is a bit vague, so maybe to revisit just some goals for the subcommittee in general and be able to report back on some of that work at the next full meeting. Of course, we also need to think about roles here. So who can be the chair going forward, as well as a note taker, or I forget the exact term that we always use, but so I can't commit to that role indefinitely. I was happy to help today as sort of interim. So we definitely want to make sure we have time to discuss that going forward. And then any other topics that we think might be necessary to cover. So are there any additional topics we want to make sure right now that we just kind of get on the list and then leave time for, or if additional topics come up, we can address them then? Okay, well, so we'll just go in order for now, I guess. But the draft report, I don't know if folks have that in front of you. I can pull that over here.
Can I
as
just make a
well.
suggestion?
Sure.
We should probably first decide on the roles for the subcommittee. Just somebody's taking notes. Or did you say you were going to do it today?
Well, I don't think that I can both facilitate and take notes effectively. Is anyone willing to just capture some of the big takeaways?
I can.
Great, thanks, Amy. And I think, we do have the recording as well, but I think the idea is that we could then work together to just submit a summary to Senator Sherman before the next meeting, or plan a brief report out for the next meeting. So thank you. I'm not sure if we want to think about a vote then for a chair going forward. Maybe that's something we can revisit when Dan joins us.
I'm here.
Oh, you are here. Hi, welcome.
Hi. I snuck in. Sorry.
Yeah. Well, since we're on the topic, do people have thoughts or suggestions for how we kind of staff this going forward?
Dr. Bush, just for the record, can I ask Dan to state where he is and if he's alone in the room?
I'm at my home in Lee, New Hampshire, and I am alone.
Great, thank you.
Great, thanks.
Sorry to have interrupted.
No. So any discussion of any volunteers to either chair this subcommittee into the future, or?
I'm happy to be the chair.
Okay. Do we need to take a vote? Or can we just?
Hi.
All right, so let's see. So I'm not really sure whether when we need to play by the official rules or not, but so we can move to make Dan the chair of the data subcommittee. Does anyone second that?
I'll second.
Great. And then Nancy, do you mind reading the roll just because you have it and we can quick capture this vote? Any discussion, I guess? Or other nominations?
You guys are doing great.
Thank you.
Just 1 second, I'm going to grab.
I think I can do it. I could just read through everyone's face here on the screen.
Okay, why don't you do it? Thanks, Katie.
Sure. So we'll start with you, Representative Murphy.
Yes.
Great. Amy Costello,
Yes.
Dan Tizik,
Do I abstain?
I don't think you have to.
Yes.
Mindy Mesmer
Yes.
and Katie Bush, yes. Great, we have a chair. Thank you so much, Dan. That's really helpful. And I am happy to always to help or review ideas. I just can't commit to doing that.
Oh, yeah, absolutely. I guess I would just want just a little bit of guidelines, since this actually is my first chair of a governmental committee, what my sort of responsibilities are, how we should act.
Yeah, well, I think so far, in talking about roles, I think you saw sort of by example today, just pulling together an agenda ahead of the meeting, making sure that gets sent out ahead of time, maybe soliciting any additional topics at that time to see if other members have topics they want to bring forward. So doing that, enough days in advance to really get that input. And then I think at this point in time, as we continue to work remotely, just being ready to really read through that right to know script, with which Aaron or other staff have been really great at sending out ahead of time. So having that right to know script on hand.
Mm-hmm.
And then I think just facilitating the discussion right as we move through the meeting, facilitating any votes that you just saw me sort of struggle through. And, if there are no volunteers or nominations for a note taker or scribe, maybe that is a responsibility that we could just commit to circulating each time someone else could do that. And so thanks, Amy, today. Unless there's a volunteer who's willing to do it sort of into the future, why don't we plan on that being a revolving responsibility? So hearing none, that will be the plan. Great, and I do think towards the end of the meeting, once we cover some of these other topics, we can revisit sort of the larger charge of this subcommittee, Dan, which I think will be useful as you think about kind of where we go from here.
Mhm.
Like I said at the very beginning, it's I think our charge is a bit vague. Certainly we have the overarching charge of the commission, but what exactly our subcommittee can contribute, I think we can talk a little bit about. But let's go back up to the top of our agenda here, and we can review this draft report. Let me pull this up. And so this, again, was something that we circulated and worked on. And at this point, I don't even know when this would take on a new life. If not, the next time we need to submit a report is a year from now. So I'm not sure, except to circulate this maybe internally with our own commission just to get feedback on kind of where we're at, maybe a little bit of a status update to help guide the next commission's discussion, right? But I don't actually think that there's any formal report that will be coming due anytime soon at this point. So I think it can be more of an internal guidance document, sort of a status update to share with the larger commission. So I don't know, did anyone have a chance to review this? Or, Mindy, you and I, we were working closely on this. And so there are just some points here, I think, where we call attention to certain people who are working on certain sections. So I don't know if we just go through this, if people have any updates or thoughts on how we get this to a more finished product.
Could I ask a potentially ignorant question? I was looking through this document, and actually the very first bullet on the charges. Since the couple of meetings that I've attended, there's been a predominance of talk about PFAS, and so absolutely important. But was there anything stated in the charter of the commission specifically about PFAS, or is it just a subject that came up and ran with it?
I can talk about that for a second. It wasn't specifically what this, I believe when we were doing this quickly, we just took some of the information from another commission report that we had done, some of us had worked on together. So it wasn't meant to be necessarily just specific to PFAS. And through the course of the commission, we did have presentations on lead and radon and some other issues. So what this commission is not specifically for PFAS, no.
Okay.
But that, I think that might just be confusing because we cut and pasted some of that stuff in from another report just to have a starting point for the report.
Got it.
Yes.
So Katie, does your suggested language come from the Senate bill?
Well, I mean, it is not the charges of the bill. It kind of is an interpretation of what this group is doing to move those forward. If we look down here later, right, the conceptual map that we worked on, these are the charges really of the bill. Each one is numbered, and that is a specific charge in the original bill language.
Mm-hmm.
And so then I was trying to think about, well, what are we doing? What are the sort of the activities we as a subgroup are then trying to do to move this collective work forward? And that's where then I came up with these goals, but maybe there are, maybe we need to just pull from the charges specifically.
You'd also discussed another bucket on that sheet for community feedback looping. It just looks blank now. If you go back down to that chart.
Yeah, and I think
it's not specifically listed in the bill, but we were talking about the need to address that. It's that, not that, it's that one right there. It says add new text. Yeah. And we couldn't figure out how to get that in there, just technically.
And that's different from getting information from stakeholders.
Yeah, I think we were trying to sort of provide a mechanism for feedback to communities that have concerns rather than just taking it in, but addressing those concerns in a productive way.
Yeah, in some ways, reporting should include all of that. Like, it shouldn't just be reports. It should be like, it sort of reminds me of what we were talking about at our last, was that PFAS?
Yep.
Where we were talking about having, like, I don't want to say TV show, was it a TV show, but like for public channels to be able to share information for those that aren't going to access webinars or aren't going to read reports.
No, it wasn't just that. We were talking about that in the other. This was more how is it appropriate to take in concerns of a community and then address those concerns with definitive actions. How do you respond to that? Like the people of Merrimack, it's not for this particular commission, but in general, you can extend it to general guidelines. How does a community report their concerns to DHHS about public health issues? And then how is it appropriate for the state to respond to those?
Right, and I'm trying to make the distinction between all the things that are listed in communicating. Sending information to public health officials and sending information to citizens sounds a lot like what you're talking about. And
no
words we need to add.
Yeah, no, it's not just about communicating. It's how do you address them? How do you perform the tasks that they ask you to do? Or how do you, it's not just about communicating. It's more than that. Maybe Nancy can expand on it a little bit.
I just want to make sure we nail it. Like
yeah.
Like I don't want to use euphemistic words.
Sure. Yeah, thank you. I think what Mindy's trying to say is something I think we've said all along, but probably haven't articulated, and those of us from Merrimack very well. It's one thing to have communication from DHHS or Department of Public Health, but what happens when the community goes and makes their concerns known to DHHS or Department of Public Health? And what is the response that? So it's not just DHHS coming and doing like the PFAS fair. That was great and it served its purpose and it was definitely helpful and necessary. But based on that, of course, many people became more informed. So then what's the next step? When the community comes and says to whether it's representatives or to this commission or to directly to DHHS or Department of Public Health, we would like to see this, or what about this? Even I'm just thinking, even like the thing is, like the biomonitoring stuff. Like I know I was part of that and was told in the paperwork, and it says the results should have been out like before last summer. I know that because I'm here, and I certainly have access to the information and do my best to get it out to people living here. But the vast majority of people in Merrimack don't know that. They don't, or actually anywhere in the state, because I know that was a larger sample. The point being, it's one thing for DHHS to communicate to a community, but it's what happens when the community comes back to DHHS or this group or whomever and says, okay, but now we want you to look at this, or this is the situation. Where's the place for the response from DHHS? And I think that's the part that we're trying to have a place. So the communication is two-way, and the response is to the concerns and the needs of the community, not just what DHHS brings forward, like they might bring forward as part of the Apple Tree grant. I think DHHS does a really good job of trying to figure out what the community needs, but sometimes it's the community that says, yes, but you're missing this. So what about that part? So I think that's the thing. It's the two-way communication and the responsiveness to the concerns of the community. And I know Londonderry, now that, just in terms of the PFAS issue, they're becoming much more informed and aware that they're in the same boat that the rest of us are here. And I anticipate that will be a large community group that will be, looking to have answers and stuff from DHHS. So I think it's the two-way communication and the responsiveness to the actual community's request for what they need or what we see as a need. So I don't know where that goes, but.
So could I suggest, I feel like I agreed that is really important to capture. And I think where we're getting a little bit stuck is thinking about the format of this report. So there was the completed tasks. And I think the completed tasks speak to the original bill and the charges of the original bill, which I tried to summarize in this document. But what I'm hearing is there's pieces that are not captured here. And I think rather than try to fit them into completed tasks because they haven't been completed, it's like our future directions, right? It's what's missing and maybe our recommendations even, right? Is that we as a commission need to address this current gap. And so that, you know, my proposal would be to leave this as it is, but maybe make a new one then that has this new section around what I would call maybe community engagement. That's what I sort of am hearing, is this two-way continued engagement over a process. And that can be, because we don't really have anything around uncompleted tasks, I don't think at this point. It was sort of a section. Sorry for your eyes. Bear with me for a minute here. But under this recommendation section, then this is where we've got community outreach, iterative feed, right? This is where we sort of captured that idea that we really, maybe, I don't know if we could identify some people to work on this, but to flush out this section as really like where we would like to see this group potentially going. Just keeping in mind that SB 85 was really about developing tools and processes for the agencies to be able to do this, right? So not unique to one community, not unique to one hazard, but really about developing a process for that.
Right, and that's what I was talking about, not specific. Yeah. I was using those examples for the Merrimack community, but I was talking about, you know, there needs to be a feedback loop process that allows more responsiveness to the communities.
So, I mean, could Nancy and I think we want to try to, I don't know, when does our group meet again? Anyone know when our next full meeting is?
December or something.
So would it be possible? December 8th. Oh, so that's coming quite up quickly, but with a Thanksgiving holiday in there. But I don't know if Mindy and Nancy, for example, if you could write a paragraph or two kind of summarizing what you're saying, and that could go in this section of sort of future work recommendations. And as part of that, I can take what you've said around, I think it's really two pieces. We could call it community engagement, and we could highlight the two-way communication and the responsiveness to community concerns and put that in this blank bucket. I'm not going to scroll all the way up there on the image with the blank bucket on the bottom left corner, and like make that yellow and put that in the bottom section here of kind of where, you know, a goal or a recommendation for future work. Is that a way to, I just like try to get this document closer to completion, and that's something we could bring forward to the commission of, in terms of future work, what are our goals even around developing that or promoting that type of engagement?
So just a question. To my mind, that process seems a bit like education as well. Are we sure that we're not overlapping with the other subcommittee? Just throwing that out there.
Go ahead, Nancy.
Yeah, I would say it's not overlapping. The education committee, I think, was based on a bill that I had in was the PFAS provider education. I think what we're talking about is the response to the community, not separate from. And I think in terms of community education, I think DHHS does a lot of that already in terms of, you know, the PFAS fair, and I'm sure things that they'll do through the Apple Tree grant and that kind of stuff. So it's not that piece. It's really responding to the community based on, you know, the sort of the results of the education and everything else. So I think they're separate.
Yeah, and I think that this conceptual diagram that we're working on is holistic, right? It does kind of, it's meant to capture the whole commission, not just our subgroup, I think, that chart. And so in terms of suggesting future work, and we may want to reconsider like our name even. I'm not sure that we are the data group. I think clearly this piece of it is not really data related, but it's about how do we sort of the information sharing or something. So that may be a topic for another day. What are the real subgroups here when we look at the charges, and what are the two maybe best categories? Yeah.
Katie, one of the things I was going to say is in terms of the data, I think that's part of what the community is looking for. They're just anecdotally and just, I mean, we're talking just in this particular instance here, the PFAS issue. We often hear, well, in order to whatever, prove associations with, prove cause, those kinds of things, that we're missing the data. I think our community anyway, I know, has been looking for a way for somebody to look at it. In other words, what I hear is, don't keep telling us that we have a problem. We know we have a problem. But to actually have the data that shows that somebody is looking at that data, and then once we have the data, what are we going to do about it? So, it's information gathering I think it's sort of identifying what the information that the communities are saying as what they would like to see gathered. So, I know just in terms of renaming, I don't know how to take all that in.
Yeah, and when I look at the charges, this is where so it's not about reporting. It's not. That's why I keep suggesting that it goes in our unfinished business or future work or recommendations, because I actually think that is a missing piece of the charge of this particular commission, because historically this one has really been about the data, getting the data to talk to each other, sending that, more the sending out of data. And so, the only place where it really lives is this piece, recommending the organizational structure responsible for the oversight function and mandatory reporting requirements. But even that's around mandatory reporting.
Well, what about identifying gaps between what currently exists?
Exactly.
I think that's what I was going to say. Yeah, number 9.
I think that's a great point.
Yeah.
So this is a gap. So we have identified a gap. So in that case, I think we can now, thinking through the report, I think we can move that into, so it's something that we've completed. We've identified this gap, but then we kind of bring it forward into the next section and now that we've identified this, we'd like, what is it that we'd like to explore or suggest? So, sorry, I'm just trying to make sure that, we are taking away some action items here. So when we look, I have a bazillion things open. When we look at this document again, so what I just committed to myself is in the completed task section, I will write up a piece under number 9. I had only been thinking about the reporting and the surveillance, really, that's my expertise, but I can add that piece. And in terms of completed tasks, and when I look at, so I've put 9 in terms of the charges over here in terms of developing a program, and maybe that doesn't quite capture it, but I can pull that out, and specifically this gap that we've just identified. But I think, again, what would be helpful is if you guys then in the uncompleted tasks sort of speak to that point around where do we want to see this commission go then? What's a concrete recommendation that we're making to build that out? And is it to engage the ATSDR Apple Tree program? Is it to, I don't know what the sort of the recommendation.
So maybe that new text should be gaps or something that, sort of encompass that one and identify that as a gap under number 9.
Right.
Under that blank, add new text here.
Yeah, exactly. Yep. So I think that's good. So I'm feeling, I don't know if folks have other comments on the language here that was, and a lot of this was just lifted from the original HB 511 final report, and as well as the minority report. Actually, there's some good details in there. And so a lot of this I feel like we had accomplished in our first year under the old commission, where we'd identified databases, we'd identified outcomes of interest. And so I think it's good to not lose that, right? To make sure it's sort of carrying on as the commission grows. But, in terms of identifying outcomes of interest here and taking that table from an IEHS, but then also somewhere, I think I pulled in the PFAS table, because I think since our existence under 511, then federal organizations have come out with more information. So now including information around PFAS and other related outcomes.
Hey, can I just, sorry. Can I just ask, can you go back to that graphic there.
The table?
The table, yeah. Now, I mean, I know they're looking at diseases or conditions of none of the PFAS related. Well, I mean,
I know that's what I just meant. So that's what I
Yeah.
just said. So here, so this whole link, I do
Yeah.
link it here, but I haven't been to this website lately in a couple days or weeks. But if you want, if you prefer that it's called out specifically, I can go to this website and maybe make a similar table so that it's not just lost in a link.
yeah, since it's, I mean, it's a huge issue here. I would like to see, because that's one of the things that we should be looking at, you know, health outcomes and things. We know we have, you know, a huge segment of the population in New Hampshire that are impacted by this environmental contamination. And I think we're starting to see research that's showing causal links of health impacts. And I think it's important to include that in a way that it doesn't get lost.
Yeah, so I know that they did come out with a new table, and so I can go back and add what's a little bit tricky. So you go to the website, right? This is the ATSDR
Yeah,
website on PFAS, and they don't have a nice little succinct table. I think that's why I just put the link, but I can, you know, I could grab a screen capture of this or just make a new table, you know, and we're at least then we are calling attention to outcomes and we can kind of cross-reference that other table.
that would be great. Yeah, I think that.
Yeah.
Good question.
I think Amy,
Did I see, I think I saw a demo of EBI or Corby as part of the Governor's Commission, the different hat on around drug and alcohol use. Is there a module planned for environmental health? Like there's currently a module in wisdom, but I thought I even saw something as specific as PFAS. So did I pick that up?
Yeah, well, so just so folks know, and this is something that we could maybe Amy, would you be willing, so in using this report as sort of our guide, do you think that you could think about a recommendation section here that would be to, you know, incorporate or review, or I don't know what the language is, but something about linking to DHHS EBI, which is our enterprise business intelligence system, which is essentially going to be our new data infrastructure within the agency.
Yeah, are we also asking to hear from them directly on the status?
I think we should. Yeah, I think that should be a request for some future presentation or testimony. But I think that's an exact, like, I think that very much aligns with the charge of this commission, is to be thinking about the data infrastructure that allows us to explore environmental health trends, right? And so, yes, the environmental public health tracking program that I oversee here has modules currently on the Wisdom data portal, and everything currently on the Wisdom data portal will be migrating to this new platform eventually. So included in that are things like water quality, things like PFAS summary data from both PEAS and the MVD study and the Southern New Hampshire blood testing, as well as the biomonitoring data from the biomonitoring targeted arsenic and uranium study, and also TRACE. So all of that should eventually live in this new data system, which will be publicly available.
I have a question about that. So does that include all of DES's water quality data, or just, see, that's the problem. That could be a gap as well, because, you know, this part of the goal of this commission was to be prospective, or be, you know, try to look ahead at what could possibly be problem areas that we are not aware of.
Yep.
And having a surveillance system that can identify that and notify people. So if it only relates to things we already know about, that's not going to satisfy that goal.
I think it'd be good to get a demo.
Yeah, I agree.
Because then we can provide that, I would hope, have the opportunity to provide that feedback too. Like how do we think about what we don't know? To Minnie's point.
So I think I'm going to put you down here, Amy, to just write maybe a sentence about, you know, what our recommendation there is, right? I'm thinking that this section is really a bunch of bullets. And so, And here I do have this already actually. So here on the status of EBI system,
Yeah,
we'll just move this down here, but maybe you can refine
Okay.
that slightly.
yeah, well, and do you want to reach out to someone at DHHS? About
Well, so I'm never sure. I feel like we need to work with Senator Sherman on that in terms of setting an agenda, and we need to kind of figure out when that would be right. And then,
Okay,
so I
I'll
think,
reach out to Senator Sherman and find out.
well, maybe as part of the notes, right? Like, so if the notes have an action item step or sort of next step section, right? We can point him to that and say one of the items that came up is to plan an EBI presentation at a future meeting. So let's see. Is there anything else that we feel like we want to capture then in this? And so Nancy, are you able, I'm going to put you down here. You're not. And maybe Mindy, I don't know. Or if we wanted to sort of divide and conquer, and I'll send this version out after the meeting, but originally also Mindy had volunteered to, and Nancy had worked on an introduction. I don't know if that's still feasible or if we want to think about how to divide and conquer this a little bit.
Given the results of the election, Katie, I probably won't be here after December 1st. So unless something changes or, so I don't want you to be able to.
That's right.
I'm happy to help out and you never know if there's a way or there's something changes or there's an opportunity to continue. I certainly would like to. But
no, I appreciate that. And I had forgotten and I actually wasn't sure of the timeline. So I just, maybe if you can really focus, Nancy, on this community engagement piece, because I think that that's something that you feel very strongly about and have really good ideas about. But if you could work on some sentences just for that section, and if you just want to email them to me, I can incorporate them into the draft.
Sure.
And then I'm happy to take the introduction piece. I think I can just look at, the old report and the bill itself. But Mindy, if you could help around the process and our summary, I don't have great personal records, to be honest, of all of that. So I don't know if you do. Mm-hmm. But if you were able to maybe focus on that part, since you and I, and Amy too, but have kind of been here through the transition to the newest.
Can I ask a stupid question? So the draft report was completed already, right? So we're just doing this to.
I think it's just kind of a status update that we could share with the full commission.
Okay.
It could potentially be part of the next report.
Yeah, but I think just to kind of, because we have some, we have some good material here, but just to
be the earliest draft ever.
Yeah, just to kind of be able to report back to the group, I think, since we didn't really get to at the last meeting.
Well, we hadn't really met either.
Yeah, I know. And so, yeah, that was definitely challenging.
Another thing to thank COVID for.
Mm-hmm. But so then I do think that really what we could spend the rest of our time right now talking about is just what are our recommendations or what is our future work here? And I don't want us to lose sight of that the initial charges were really around, this data interoperability, like Mindy was saying, using the data to really signal when there are issues. Mm-hmm. Where's that bill? Lost it. When we look at the original charges. So yeah, do we want to spend a little bit of time just kind of talking about this group's role and moving some of these initiatives forward, or which ones are kind of left undone, and we could put those into our recommendation section as well?
Well, in the previous iteration of this commission, we were talking about what gaps there were in interconnectivity, like insurance billing and the prison network or what, I'm not sure, I can't remember the name of it, but how a lot of the data isn't connected at all. Different systems are, is the EBI going to be connecting up? I mean, is that the way we're moving forward with DES? And are they?
So that's just within our agency. So that's just a DHHS tool. And I think the reality is if we can stand up systems within agencies, then we can start to think about how do they talk to each other. And so I think we are just at the stage of getting systems to stand up within an agency so that, say, our death data can talk to our cancer data, can talk to our Medicaid data. You know, I think that's where we're at, just realistically. Not that we shouldn't aim for that in the future.
Well, and I think that's actually maybe a good question too. I mean, not Katie, I'm sure you have a great pulse on this, but if monies are identified, like if money flowed through DES, is there anything precluding DES from participating in EBI? And I mean, just based on the history of the two agencies, I would hope that there's no barrier, you know, that there would be, you know, assuming like unlimited resources, human and otherwise.
Yeah.
You know, but if billions of dollars flowed through flowed to a DES to build a data system, it's like, God, why wouldn't we want to leverage what's already at DHHS? And I wonder if those are some questions that we could pose to whoever's presenting EBI. You know, I'm thinking of like a David Wieters or Andrew Chalsmar, you know, people that have been kind of central to the knitting and braiding of funding.
Yeah, well, and I know on the DES side, I mean, it's interesting, they and transportation and safety, there are some groups who do a lot more spatially oriented work. So there's kind of a network of agencies there that are working together on the geospatial information side of things. And we tend to not be there because we have less spatially, you know, specific data.
Mm-hmm.
And so there is a move to have kind of cross-agency platforms for geospatial work. I think the challenge is that HHS is so big that it's a humongous undertaking to just get our data talking to each other but I agree that if we can arrange a presentation, these are good questions.
Yeah, and if it were a light lift from DHHS because the money was flowing from some other.
Yeah.
Well,
like,
I don't.
Yeah. Also benefit. You know what I mean? All
like
right. Well,
CARES Act funding. Is there a way to use CARES Act funding, because there's a lot of issues that have been challenges to the department for contact tracing and things like that, you know, that could benefit from some of that money. That I don't know if that's a plan. The other thing I was going to ask was the TRACE program, the TRACE biomonitoring program was supposed to be kind of what we thought as like a pilot study for this, right? So in the presentation to the commission about the results of the TRACE study, because that's really geospatial, public health, and environmental data, maybe some recommendations could come out of that presentation about the need to continue like the TRACE sort of an approach across the state.
Yes, yeah, I think absolutely. And so what I'm hearing is sort of two different recommendations for future studies or future presentations that would help move the data infrastructure piece forward, but also that routine surveillance, I'll call it, right, of the either exposures or health outcomes. I mean, I have seen the TRACE data, you know, some summary data, and we definitely see some things that look unusual in New Hampshire, right? Like, not surprising, arsenic compared to, you know, national NHANES levels. And so I agree that that's almost that signal that you're looking for is when we see unusual levels there, then we can kind of take a deeper dive. And I do know that the plan currently is to repeat that 5 years from the original start date of the original study, but then the money, you know, the federal funds for that then I think go away. So unless they're continued to be funded federally, you know, that could be an opportunity again for funding ongoing, right? 5-year interval studies. So I think that, yeah.
Can I ask Katie, if there's a plan to repeat that, is it with the same participants or a different pool of?
You know, I've asked the same question. I think they are going to try, but I think we know that we'll lose some people to follow up. And so I'm not exactly sure, because I think there's also value in a random sample of a distributed population, but surely there's also value to be able to track within some individuals any changes. Right. So I do think they're going to try to recruit within the same pool, but then also draw a random sample of other participants. to
Thank you.
meet their target population goal. But I'm not sure, and that'd be a great question if and when they're able to come present to the commission, I think. I mean, I can go ask in the interim, but I think that's a great point to make.
Great, thank you.
So let's see. Amy's taking notes, but I need to take some notes too. Hold on a minute here. So one is the EBI.
What to do.
Funds, connecting to DES. And then the second is biomonitoring. So I do think that in the recommendation section or just in future conversations, I mean, I think what's been a bit nebulous is what is it we want to track? Because I think to Mindy's point, how do we know kind of the next thing? But we can't test everything, you know? So what is a system there? And I think when we have biomonitoring data, we can see what's unusual and then maybe go do additional testing. You know, so I don't know if does this group think that we need more or better like reporting of the outcomes we've listed in this document, either those listed by PFAS, you know, do we feel like we don't have regular enough or routine enough reporting of these environmental health outcomes? And, you know,
Yes.
and so, you know, but what frequency of reporting? I think we've heard from some groups like the cancer group or other groups, you know, that 5-year reporting kind of makes sense because you have enough data and you have enough trends to be able to report out on, but, you know, we don't necessarily report out on some of these outcomes of interest.
I want to just mention something.
Yeah.
Absolutely. I mean, I think, you know, we looked at early on just in the PFAS thing alone, we were looking at the cancer data because that was really all we had. But we know that there are many other health outcomes, and those are the ones, you know, that we're all we had this largest study nationally that we certainly have health outcomes associated with that. And those are the things that I would like for us to be looking at. I don't know that that's been collected anywhere at all. So that's a gap that I see, and especially when you're talking about the interconnectivity between DES and DHHS. One of the bills that I had was it's a PFAS bill. It was a firefighting foam registry and DES liked that idea because number one, it would help them to figure out where to target first, with spills and that kind of stuff. But that's the piece. I mean, this is an environmentally triggered chronic disease commission. And we know that many of these health outcomes are obviously triggered by environmental contaminants, et cetera. And when the two DES and DHHS aren't talking to each other and don't have the ability to, I'm just thinking in terms of the bill that I had, the plan was for DES to be allowed to put GIS mapping on locations of, where this, Class B firefighting foam was stored. My goal was, down the road to be able to overlay that with the health outcomes the same, in those same areas. And that's why I think it's so important that DES, be part of this, that the information that they're gathering and the information that Department of Public Health gathers, that there's that overlay. So we see those things. And I think that's, that's a gap, that and the lack of data being collected around the health comes and, and just in terms of, PFAS alone, never mind arsenic and those other things.
Yeah.
But.
Well, so let me just I have one project out. I don't know if folks are, and when we get to talk to the commissions, I think about some of the ATSDR work that's happening in New Hampshire. There is this exciting new project around safe siting of childcare facilities. And so as part of that, we do want to compile a lot of these relevant environmental exposure data sets. So a lot of them do exist, right, on the DES website or the DES One Stop. But it's not like readily available or readily easily to overlay. But what part of this project is to get it to talk to data like where our childcare centers are. And so you could imagine that then you could also create other overlays. And so I think that the reality is there's always going to have to be like the person behind the scenes making that data integration happen in the short term, where you kind of pulling it from one space and then pushing it to another space in terms of how data moves across the state agencies. But so just to say that there is some work, I think, to compile things like hazardous waste sites, air permit sites, and perhaps even start to think about a firefighting, where they've kind of known hotspots for this childcare project. And as those become created and available, I think we can find other ways to disseminate those. I think the trick always then is like the overlays. And looking at this list of outcomes on the website, for example, right here that we have open, it's like, we don't have great data on increased cholesterol levels. I think sometimes it's tricky. Some of them are really clinical proxies for a disease endpoint, right? So in terms of just like where the data really are, trying to really understand the gaps here. So the data sets that live in here at the health department are really, they're not the clinical proxies. They're deaths, they're hospitalizations, they're a cancer case. So I think this is where, Amy, your work at UNH and all the work being done around maybe insurance claims, those are maybe better proxies for some of these. And maybe, a recommendation is to explore these innovative or novel data sources, such as claims data, to develop indicators of these clinical proxies.
Yeah, and even the claims won't carry high cholesterol or HbA1c results because it's not a claim. You don't need it to pay a claim, which is frustrating because it'd be great to get that clinical data in there. But does that, I don't know how much this commission wants to take on, but are we talking about resurrecting health information exchange and being able to look at electronic medical record data? Because that would be super granular. And yet there is a really,
strong opposition, we'll say.
Thank you. I was looking for the right words. Historically strong opposition to that.
Due to privacy concerns, you mean?
Yeah. But are we hitting a tipping point with COVID and other conditions, this, environmentally triggered conditions that says, now is the time for the greater good to consider looking at EMR data for public health.
Yeah.
Yes.
Especially when we know communities are, that have high environmental exposure are more vulnerable to the impact of COVID-19, things like that we need to, and COVID's not going to be the last and only pandemic we deal with. So, I think there's a value to that in the future. And I just want to say one thing, getting back to the previous conversation, Katie, I did environmental consulting for 30 years, and I would routinely contract with companies that provided radius map information for things like healthcare centers and children's, daycares and schools and things like that based on environmental risks. So I wonder if the state would consider maybe, I don't know how, that could contract with an organization like that. It's called Environmental Data Resources, is the one I most recently used. But they, you basically give them the coordinates that you're looking at, and they'll provide you with radius maps of all the potential exposure or receptors in the areas. So it's not, it's not something, we're not reinventing the wheel here. It'd be the same kind of thing. We'd want our own DES to provide, but maybe there could be some help from an outside organization like that.
Yeah, no, that's a great suggestion, I think. What was it? It was environmental data.
And they may have just changed hands, but they're called Environmental Data Resources.
Okay, I did get it right. Good. Yeah. No, I agree. And, I think we know that the agencies often are contracting out work that can be done quicker or easier outside the agency. So especially when there's sort of publicly available data. So, I think that's one of our challenges, is that what the literature says is relevant is really hard to get our hands on. So, I think part of the commission's work is to figure out what are the indicators we have readily available that are good proxies. And certainly, kidney and testicular cancer, we do have that from our cancer registry, and birth weight we have from our birth certificate data, but so maybe, and I think this is where we have to make some choices as a commission of, do we move into the spaces where we can, but noting what's the gaps are, or do we try to really, the big lift of getting all of it, but that may then not be feasible. So I think that's where we've been a little bit stuck as a commission. Do we make progress where we can and know the limitations, or do we?
I always go back to, our commissions are not meant to be really bound by budgets. We're meant to investigate how to solve the problems and then leave it to the others to decide whether we can afford it. But at least our goal, I think, is to identify things with blinders on about the costs, and look at ways to move things ahead, like the things we were just talking about, for the future.
And I think I think that's very true. I think it's valuable, though, to be as specific as we can be in our recommendations. And so if there's a real specific, like low-hanging fruit, let's call that out specifically, like, I don't know, the firefighting foam layer, right? Like that's really specific. And that can be one piece of like a larger initiative of just making other environmental exposure data more readily available, right? Like there's the big lift and then something that's really attainable. And I think sometimes if we're not specific, it gets kind of written off as too big, right? And then no progress is made.
So the birth weight registry, I can't remember what other meeting it was we were at, Katie, you said we could revisit that, we could re-up that whole, and I don't remember. But that, because, the impacts to our children are the most concerning to me anyway, as, looking at the future of New Hampshire. I wonder if that is a low-hanging fruit type of an issue that, the structure is already in place. It's just that we never funded it recently. And, we now know that these impacts are pretty clearly rising to the surface as, low birth weight issues from PFAS exposure. We know we have PFAS exposure in our community. So that would seem to be one of those low-hanging fruit sort of issues that maybe we could really, and that also helps people to understand more about why it's so important to address our environmental issues, because it does impact our children,
And I think that also speaks to the necessity, and we've been saying it over and over for 5 years at least, for the provider education around PFAS, because we have communities that are disproportionately impacted, and we believe we're seeing the health impacts, and we have citizens that are more informed than their primary health providers. So that's huge. We have, the data is there, but if providers are not recognizing what they may not even know that they're working within an area that is disproportionately impacted by what PFAS in this situation. I mean, all of New Hampshire maybe for arsenic, but certain areas, and that's why I think that is such an important priority. Until we have the people that are saying, the patients come in with these diseases or conditions, recognizing the impacts, then there's a lot of information that's just not being reported. I over and over, I think of the endocrine disorders, and I know we had talked about that in the other commission, but I look and I think it will be astounding. I think if anybody looks at that here, and in these kind of in the southern New Hampshire communities here that are impacted, if I were a betting person, I would, I think that's going to show some significant stuff. But nobody, even our endocrinologists, we're surprised to find, why they were seeing some unusual things here, that they weren't really aware of the exposure that we have. So that to me is huge. Getting providers on board and whether it's at medical meetings or extra stuff for CMEs or whatever. I just think it, especially even if it's just initially targeting those areas where the most impacted Seacoast area providers and those hospitals and southern New Hampshire areas. I mean, clearly we need it everywhere, but if we have to start small, that's those are the priority areas, because those are the gaps. Those are huge gaps, and the lack of our providers being aware of what they're looking at means they don't collect the data, or things can be attributed to it's an endocrine disorder, families that have never had, there's no genetic whatever. So I'm happy that we're looking at really identifying those gaps and
I think
prioritizing
that's so and I think that fits that, I just keep coming back to the charge. This is the bill text. So here under
Yeah.
13, right? So that we would develop protocols for the department to educate and provide guidelines for physicians and other healthcare practitioners to identify and evaluate appropriate diagnostic screening tests and assess health effects. So, I mean, again, like, I'm not sure that we're really the data subgroup talking about this, right? But it's like, how do we get the right data or information to providers so they're informed in their conversations, right? I think that. And so maybe it's using the trace biomonitoring results to then target some outreach education, or we are also working on mapping well water quality across the state. So then it could be about targeting maybe providers in certain areas where we show high historical arsenic or high historical pick your other contaminant, cadmium, I don't know.
I just, when I look at this, it says collaborating with, the EPA, and we haven't had much luck in terms of, regulations. I just look at PFAS MCLs. To rely on the EPA and having to collaborate. I think New Hampshire has to do some stuff on its own because, we're a little ahead of the game, I think, in some areas, and should take full advantage of that, being sort of forewarned. And, we have the information that, we know, look at DES, John Ali and everybody did, we know what we're looking at. And so, be nice to, we've been a leader in some areas. I think this would be a really great place to say, this is where we need to lead.
Yeah, and so again, I think it's about figuring out what those indicators are. So, what are the health endpoints we have access to around endocrine disorders, for example, and maybe calling attention to those specific indicators. And so maybe that's a recommendation, is to identify those endocrine disorder related outcomes and relevant data sources, right? I think that's
Absolutely.
something we could talk about, because I'm doing some Googling here on the side and I'm not sure what outcomes those would be. And I don't know that those are captured in our table that we had here. Right?
Yeah,
So,
I mean, for me, I just, thinking of like thyroid. I'm a nurse, used to be a nurse in the old days. And I look in my own family, in one house here, we have 4 people, all unrelated, because my children are adopted. 4 people with all diagnosed in the last 5 years with thyroid disorders. So now that's in one house, not including the people across the street and the next door neighbors. I mean, that's just one little, and you say, okay, you can write so much off to, odds and everything else, but 4 people in one home, unrelated, but all having, double-digit years of exposure to, being within 1.5 miles, 2 miles of St. Cobain, having the most contaminated wells, it just, and everybody that we, and this is part of the thing, I think, when we talk about the community impact, that's what we hear all the time is, why is nobody looking? How come we all have so many thyroid disorders? That's the piece. And nobody, say, well, it's not cancer, so it really doesn't get counted. And the providers haven't, some of them have not been, thinking that that's an issue. And I just know that when I talk to the pediatric endocrinologist at Dartmouth, she happened to live in this community. And when I brought one of my adopted children there who was diagnosed with Graves' disease after losing like 40 pounds in 2 months, and we've done children's and up at Dartmouth, and she said, she goes, I can count. I said, what are you seeing in your practice? This was in Manchester. She was in Manchester and Lebanon. And she said, I can count on one hand how many children that I have with Graves' disease diagnosed at that age and with the, symptoms. So she was saying, she was definitely concerned, and she's more informed than others. And so, we did a lot of information, gathering and suggestions for Dartmouth. But that's the kind of stuff that until providers are, made aware of, say, hey, what are you seeing in your practices? That's not even, just counts. What are you looking at numbers in certain areas? Those are the kinds of things that I would love to see, somebody looking for the data, because I think that all the anecdotal information is here, but there's just no place to go with it, really. So anyway.
Well, and I do think that is certainly within, the role of the public health agency is to be tracking and conducting surveillance of certain outcomes. So I think to the extent that this commission can really narrow in on a focus of, these are the immediate things we'd like to see surveillance done on, and then these are the bigger, longer term goals or more of the reporting, right? But maybe the ask is at least, a sort of a snapshot in time of some of these environmentally triggered outcomes. I think the trick for us is condensing that list into something that's feasible to report on. So when we look at this list, what is the list? And maybe we just need to really.
So getting back to Representative Murphy's question, and maybe it's down below on this table, but so actually there's no mention of endocrine here.
Right.
So I wonder if there's actually like a follow-up to NIEHS to understand if there's any update or planned update to this table too, because that was the frustration when we first identified this table was, okay, so under reproduction, what diagnosis code am I looking for?
Right.
Because you've got to tie it back to the data somehow if you want to look at the data, and yet like lead in reproductive health is not a diagnosis code.
Right.
So what diagnosis codes are we looking for outside of breast cancer, endometrium, or endometrial cancer, kidney, colon, lung, esophagus? It looks like NIEH is struggling with identifying them with them. Otherwise they'd be in this table, right? Unless there's some plan to identify them. And I think the same, getting back to the other question though, too, about if we're going to connect DES data into EBI, what are some of the contaminants that should be tracked in a surveillance system, understanding that it won't be the thousands or millions that public health lab can detect, but what's the short list? And I don't remember if we'd gotten that from Jonathan, Ali, about there's some listed here, but pesticides is kind of a big group.
Right.
PCBs, unless there's an easy way to organize it. I think when we look at pharmacy claims, the pharmacy claims can organize pretty easily into a manageable set of group, like 100 groups, or 300 episode treatment groups for medical claims. So that you're not looking at an unwieldy number of different flavors of depression or different flavors of breast cancer. It can group things. Are there groupings that are reasonable? Mm-hmm. That won't mask something too? But maybe there's just a general understanding of how do you do surveillance in an interesting way? And apologies if I missed that presentation or missed that part of the meeting or I'm forgetting. But if we're truly thinking about some type of surveillance system that captures both the health outcomes and contaminants, those we know and those we don't know, what is the best system to set up that would flag them?
And it needs to be,
not give us a false assurance either. I don't want to have pesticides show up low because overall all pesticides are low, but one of them is spiking in my backyard.
Mm-hmm. Yeah.
Sorry, Mindy.
And it also needs to be malleable so it can expand in the future, because we're always finding the new PFAS, group that needs to be, so it needs to grow also. But I think that the way this list, at least on the right-hand column, goes is a good list. I mean, you can look at, the whole category of pesticides, knowing that, only one of those pesticides might have been tested to come out with the outcome that we're concerned about. But as a grouping of chemicals, that PCBs, phthalates, pesticides, those are all good groupings, and asbestos and silica and solvents, they're all, I think that's the attempt you're talking about in the right-hand column, is to group those. And then they look at the outcomes, which should be in the middle column, which.
But are they granular enough? Is air pollution granular enough? Are pesticides granular enough?
No, I mean, I think that's not even, yeah.
As soon as we decide on a grouping, then it's the next commission that says that these are not fine.
I think this is an outdated table, to be honest. Like, I get concerned.
Okay, so it's to go back and get it.
I think this doesn't, like you said, I mean, I think it doesn't even address PFAS at all. So, I mean, I think it's really outdated. It may have been done in the mid 1980s or something. I don't know. It's not very up to date. I mean, it has silica on it, but we've known about silica stuff for a long time too. So,
anyone have time to do some digging for a new version of this?
I'm doing it.
I can do it.
Yeah,
Oh.
Dan, that'd be great too. I think, if we could do some now, if we find something, but Dan, if you could spend some time just poking around on NIEHS, I think this is clearly like an overview summary of the findings, the kind of the current state of the science, linking environmental exposures. And I'm not sure if we ended up making this just like pulling from information that was on the website, or if there's an actual table somewhere in a document.
It was an actual table.
Yeah. It's one of the problems as people have moved to fancier websites, I feel like, right? They no longer you got to point and click on all these things and you can't just get the table like the PFAS one, it's like there's no just table now to download. But I think that would be great, Dan, if you can maybe look at that. And I think we can operate over email too, right? So if we find something in the interim that we want to share with a group, we can use that email group from sending out the agenda.
This doesn't even have like cyanobacteria on it either, does it?
Nope.
Yeah, which is a big issue.
So yeah, we're definitely noticing, I think, that it's missing some outcomes and it's missing some specificity of the exposures. And I think right now is using this report as our guide. I think we can put that in as a gap at the end, and I can work on summarizing.
We might have to come up with our own version.
Right, exactly. And I think we should. I think because even if this is what the feds say, like, what about here in New Hampshire? What do we feel like, based on our experience, is important to track? And so maybe this is the whole big vision, but like, like Amy said, the short list that this commission is really recommending. Yeah, I have to be careful, right? I don't want to direct my own agency's work here. So I always have to be a little bit careful.
Yeah. Dan, do you have any, I can't remember, are you from New Hampshire Med?
Yes.
Okay. And do you have any limitations on what you can do or say, or?
Not to the best of my knowledge.
Okay, great.
Which the knowledge is limited, but not to the best.
Okay.
So I don't know, this is a piece, this last piece, number 15, recommending legislation. I don't know if this point, if this group feels strongly about recommending any legislation, or really it's maybe just more recommending internally for the commission things that we really need to focus on over the next couple months so that we can have some targeted legislation in the future. Just trying to think about things that we want to be able to report out on to Senator Sherman or the full group. Like I said, we have our internal recommendations that we've been talking about. I don't know if there are.
Can we support legislation? I mean, that we know is coming. Like, I know that AFFF firefighting foam bill is going to be coming through your Class B registry. And I know DES was in support. Rosemarie Rung is going to take it over. It was my bill, but she's going to prime sponsor it.
Yes, I mean, I am not a representative at all, but I would think that we'd want to bring that to the attention of the full commission so that other representatives can, support those bills that align with the charge of this commission, I would think.
Yeah.
Do people know of any others at this point in the pipeline that we should try to capture and bring to the full group's attention?
Can I, Representative Murphy, Nancy, can you send a summary or something to Representative Mesmer that she would bring forward to the full commission, or how do we carry on that?
What are you
I was just
talking about?
planning in the report. I was just planning in the report section to, under recommendations, that we have sort of our general commission recommendations, but then also a section on legislative recommendations, and to just put there to support, you know, legislation in the pipeline. For example, this firefighting foam registry bill that will be coming forward, and we can look
Yeah,
up the
It
number.
was House Bill
Yeah,
1569 as
Mhm.
amended.
Okay. And if I was wondering too, if it's gonna be strong, having it, like, what are we trying to do with that? Like, is it better for this, for the full Senate Bill 85 commission to say that we're gonna support that? You know, like, do we leapfrog this a little bit and say like, okay, here's a link to the legislation. I can include it in the notes for a next step for Tom Sherman to bring forward to the full commission.
You know what we really should do, and this has happened in other commissions that I've been on, is we should peruse through the LSRs that are filed and make recommendations as we see fit to the larger commission about what, if we want to do that, about what we should support that is within,
Okay.
you know, our goals or our connected goals.
Can,
I'd be happy to do that, and maybe Nancy and I could do that if you have time, Nancy, but once
Sure.
the stars
Yep.
are dropped.
Yeah, because I know I had a couple of them that are going in, and that would be helpful to this commission and 737 commission too.
Yeah.
So
Even just to have it on the radar, you know, that
Yes.
these are environmental public health issues that we should keep on our radar, even if we don't want to fully support it.
all right, so for the notes for this meeting, I'm gonna include just that Representative Murphy and Representative Mesmer will review the current LSRs and review an inventory.
And suggest possible, you know, supportive legislation or whatever, however you want to say it, if
Yeah,
as
yeah.
appropriate. Suggest to the larger-
regarding number 15, that's a thing.
Could I ask a stupid question?
No such thing as
What's
stupid
an
questions,
LSR?
but
It's a legislative services request. So it's the beginning of when first a legislative services request LSR is filed. It becomes a bill later on with a bill number after it becomes enrolled. So it's the initial proposal for legislation.
That would be good to support those LSRs, but also for us to get a great lay of the land.
Yes, exactly. That's
Yeah.
what I mean. Yeah.
Yeah, thank you. Sorry, I'm a little slow.
No, okay. You can't read my mind.
Almost, I'm almost there. Maybe this is my compulsive nature because I'm not looking at the Zoom, I'm reading my notes, but I have Representative Murphy will draft a section about community feedback loop for the draft, this is the draft data committee report, right? It's a status report, is that what we call it?
Yeah, status.
Okay, which might serve as part of the final report in the end, but anyway. And Representative Murphy and Mesmer will review and suggest support of current environmental health related LSRs. Ms. Costello will score potential for an ABI presentation at a future meeting, a presentation of ABI at a future meeting. Some questions from the data subcommittee is what is the current state and plans for surveillance? These are questions about the ABI. Can ABI be used for DES data? What needs to happen? And are biomonitoring data being included? And then Dan, you are going to be viewing NIEHS for current list of contaminants. But should we also look into a presentation for the birth defects registry?
Yes.
And Katie, is that unfair to ask you to do, or is that on your list, or?
no, so I think captured in the notes, and that's something that I can start the groundwork here. It certainly lives within our, Bureau of Population Health and the maternal child health group. So I think we could talk with them about coming to a future meeting or a subgroup meeting to really understand what did exist previously and maybe what could exist.
Yeah, and if it happens to be David Laflamme, can we, this is being recorded, can we pick on him and ask him to think about other environmental health, so beyond birth defects, or, if he has anything else that he wants to share from his purview as the MCH epidemiologist around environmental health. So are there things that we're missing on the birth defects registry in its former incarnation, or are there things that other states are doing in creative ways?
Right.
Like
And I think that's important always, that when we think about these big potential sort of improvements, that we aren't, we're not just thinking about PFAS, we're thinking about environmental health. And maybe we're not just thinking about environmental health, but for example, like race and ethnicity continues to be a data point that we really need better, higher quality data on. And so like these data process improvements, I think, the broader, we don't want to be too broad, but I think then we bring more partners, more stakeholders, we have overall more support for those types of initiatives.
I do think world domination is important.
So yeah, I think,
but
and
that's
that
the
is
issue,
something.
right? It's like, then we end up in these narrow tracks of, of looking at just PFAS. But if we can build a system
Exactly.
that can be, augmented and a little bit plug and play instead of one-off. And I think there's some great opportunity to do that in New Hampshire.
And I think we saw that with the opioid epidemic, right? And wanting to be able to track birth outcomes related to opioid use and being able to stand that up quickly and start to track information on birth certificates. I mean, so we've seen that, I think.
And the EPI was born out of opioid funding. And then other pieces of funding came in.
Yep.
And that's where I want to make sure that we always kind of have in the back burner, like, not, or in the back of our heads, like being open to where the funding might come from. And that may not be a health related fund. It might be from the environmental side, or who knows.
Well, I mean, the state is going to be getting, a settlement from the manufacturers of the PFAS lawsuits, 2 of them. So, those will bring in a lot of money. So it's good to get in line for the earmarking of those. And maybe actually, that could be a recommended legislation that we put out as a commission is, we need X number of dollars to adequately assess the impact on low birth weight in New Hampshire, or, starting up the registry again. That would be actually a really direct, good use of that funding to assess the public health outcomes, because those lawsuits are specifically for environmental and public health damages in the state of New Hampshire. So we should start earmarking some of those funds for some of these things that we're talking about.
I'm going to send you all a copy of these notes unofficially, and you can help me with wordsmithing the notion of tying some of our efforts to earmarking before it becomes official record. Like I like what you're saying, Mindy, but I don't I want to make sure that we state it correctly too.
Katie, could the DHHS come up with an estimate of what it would cost to set that back up? And I think we could get Rosemary to put a bill in this fall, even to start to earmark that funding to trace it back to setting that up. It's good to have it might take a couple of years to get it through the legislature, especially when we're having the COVID thing, but it's good to start doing it, and start talking.
Yeah, so I'll talk with partners here about a potential, just an overview of what the registry was, but then also sort of resource needs around that.
Just beyond that, on that same thought though, what about, I'm just thinking, Mindy, of like the C8 study, all of those health outcomes. I mean, is there a way when we're looking down the road, and I mean, I know it's going to be a while before there's any, before those lawsuits are settled and we see anything from them, but beyond just the birth weight
Yeah.
thinking a little bigger,
Yep.
shouldn't we be looking at, I mean, this is a huge issue here. And shouldn't we be looking at those, I mean, that the C8 health study, those are the things that I would like to see
Mhm.
targeted for, and certainly, I mean, funding is going to be related to PFAS. I would think that it would make sense to be looking at those. Those are the health outcomes that we know are related. So I'd love to see that.
Yeah, like
Not
how would
only
you
the,
track ulcerative colitis? Is that I mean, Amy, how would we be able to, I mean, it's a diagnostic code, right? That you then, yeah, so you could probably track it.
Yeah, if you've got a diagnosis code for it, we can try to get it.
Stuff like that, where we could pick off the low hanging fruit. That's a good idea. I was thinking that the birth weight thing would be a really good low hanging fruit, but maybe also some of these other ones. You're right, Nancy.
And just to clarify, is it birth weight or birth defects? I thought it was a birth defect.
It's low birth weight, but I think it would also be valuable to track any birth defects. But it's definitely
is the registry that was set up before
Birth defects.
Birth defects. Okay, I just want to be clear in my head. Birth weight is tracked.
Yeah.
Regularly, but yeah.
Yeah.
Is that tracked inside that registry or no? Is that separate?
Separate, yeah. It's more of a birth outcome kind of reporting. And so I want to just be cognizant of the time. And so I think, help Dan out in his new role as chair of subcommittee here. But I think at a future meeting, if and when we're able to do this again, I really think if we focus in on this number 5, defining the indicators that are of priority interest to this commission, like that's maybe what our next meeting should be about. So if we could all think about, these different resources, the C8 panel, the NIEHS website, like if we just came together and spent an hour really refining that list, building on all the kind of websites or old tables that we have, like that would be a really valuable next meeting. And I don't think anything precludes us from meeting. Do we still have people in the background? Like we could even spend a minute, try to get another meeting on the books. I don't think we necessarily have to wait for the full meeting.
Right.
But to think about getting something on the calendar where that could be our agenda item. And then
I would say that just to get it in the notes so I don't forget, Amy, the arsenic consortium and the lead with respect to the developmental impacts on children would be in something important. We keep bringing this up with respect to now that PFAS we know is connected to some of these issues too. It's kind of 3 different exposure, groupings are ending up in the same place that we should really start looking at how to track that too. Maybe through special needs funding or some other, I don't know what coding mechanism we could key into somehow for that developmental. I have no idea how we would do that, but just to tag that as something we should look at.
So issues identified in the arsenic consortium and
lead, arsenic, and now PFAS are all known to impact, children's, whether or not they need special services or not for educational impacts. So all 3 of those are leading to the same path that we should be tracking that in the state to identify, hopefully ahead of time, where there are issues.
Yeah. And I think we can think about what are the endpoints there, right? So whether it's a diagnosis of ADHD or other cognitive behavioral outcomes, but then also another key data set, I think, is the special education, either fund allocation or special education, just numbers. And I mean, that would be interesting.
Somebody should come speak to us about that.
I think that's great, Katie. I mean, I think of it like in the Merrimack community, my children, my almost 40-year-old has now, of course, has children in our school system. And Merrimack, we often hear the tax rate is so high because we have such a high special ed population. And, years ago, people used to say, oh, it's because Merrimack was so great, people moved there. Well, that's not necessarily the case. However, we have the children who've been drinking this contaminated water all their lives and going to the school closest to the polluter now has children in the school system, and I just think I have 6 grandkids and they're all in the school system. And I talked to our director of special ed, and stuff, and they're seeing, huge numbers of children requiring services, in their, kindergarten and, pre-kindergarten programs. So I absolutely think that what I think you just said and Mindy said too, the education piece, what we're seeing in terms of coding for IEPs, and what, looking at what school districts are, what kind of services that they're having to provide to children based on what needs.
Yeah, so I think that would be somebody from the Department of Education, really. So I don't know, Amy, in your notes, if you have sort of a section on suggested future presentations, but I think that would be a good one. Or I don't know if there are researchers. I don't know if within UNH, if there are more academic partners who specialize in this. That could also be interesting, I think. Someone who's actually done a deep dive into the data versus just so could explore that as an option. But so just with the time that we have left, do people have other suggestions really to help Dan now think about pulling together an agenda for a future meeting? So I think really coming together, having done our homework, some research, with really trying to refine a list of outcomes, priority outcomes. And with that might come an auxiliary list of exposures, right? I think that those will be linked, but if we stay focused maybe on the outcomes for now, that's a real targeted kind of next step for us. Any other things we feel like we want to make sure we carve out time for at a future meeting?
I think updates on where we are with planning the presentations, synthesizing the information from those presentations. Hopefully we'll have presentations about EBI and the potential to include DES and figuring out, okay, well, where are those opportunities and barriers and how do we knock them down? Same with the birth defect registry, if we have a cost of that, and more information about what it does and what it doesn't track, then I think that would help us pivot.
Yeah, so Amy, it would be super helpful. I don't know if you're going to plan to write to Senator Sherman directly, but I think to get clarification on whether these presentations should be planned for a full commission meeting, which I think that they should be, but just to maybe get clarification, and then, if we want to start to plan those out, I guess, right?
Yeah. So I put in the notes that I'll explore it, and that means I'm going to reach out to Tom first.
Okay.
And figure out what makes the most sense, and then I can bring that proposal to whoever I think would be presenting.
Yeah.
So
and maybe the order can be a little bit based on availability, and also, when the biomonitoring report is done, ready for release, right? So, but the birth defect stuff maybe could come sooner, because that's just at any time kind of historic presentation, really. What has existed previously. Yeah.
Well, and find out what the bandwidth is for that.
Yeah, and recognizing that everyone here, right, is stretched pretty thin, but I do think I have observed sort of an eagerness to engage on other public health issues when
I can imagine.
So yeah, it's hard, but yeah. What else? Dan, what are you thinking? Anything you need from us as we think about a future meeting, or do we want to spend a minute trying to think about a future meeting time while we have some?
I was just going to suggest that from what I think has been discussed, I think that's probably going to involve a fair amount of discussion, and so myself anyway, I think that would probably be good as far as topics goes. But arriving at a date and a time would be fantastic. And taking into account as well that the full commission meeting is December 8th. Do we want to have, so it's the 17th. I wouldn't think that we would want, do we want to have another meeting before the full commission? Or probably after?
Yeah, I think with the Thanksgiving holiday, if the commission meeting, the full meeting was a week later, I'd say we could sneak in one, but I'm not sure there's time to sneak in another meeting unless, I don't know, does anyone feel differently the first week of December?
We get to hear from Representative Murphy if we book something in November.
Yeah, let's get her in before she leaves, another meeting. Before December 1st.
Is that predatory?
Yeah, I think it's officially December 1st, right?
Yeah, and if 11:59 p.m. as a matter of
Yeah.
fact.
So, yeah, we have a couple of weeks, so we can
Yeah, but
fit
it's
it.
I mean, I do-
Thanksgiving, and so I will definitely email the, the things that I'm supposed to do, and we'll see what happens. I certainly very interested in the work, and I want to say thank you today. It was a really productive meeting. I feel like we accomplished a lot, and really have a sense of where we need to go. Just it's sometimes it's overwhelming, but I think this was a place where I think we're all on the same page, and we recognize what we don't know, and where we need to. And congratulations, Dan, on your chairmanship of the subcommittee.
Yikes.
I mean, I do have availability on the 30th if people are serious about trying to get together one more time, and that might be nice. I mean,
Even
we
if
could,
it's like 2:00.
just an hour, because then we might really have that robust list ready to share with the full group, which would feel really good, I think, for all of us.
Yeah. Aaron, are you still with us? Is that?
Yeah, I'm here. It's Alan.
I'm sorry.
No problem. So you wanted to do it on November 30th at what time?
2.
2
Does
o'clock.
that work for everybody?
Yep.
It is open. I can put you guys in there, and I will give Aaron the notice language he needs to put it in the calendar.
Awesome.
All right. Yay, Nancy.
Yeah, thank you. So I get one more, just one more.
Great. And yeah, and I'll do my best to also get that document cleaned up and shared beforehand, so we can then send that with our new updated list that we'll work on to Senator Sherman for the full meeting, which I think will feel good, and they'll be happy to hear from us.
Great. Awesome. Thank you.
Yeah,
Do we
So,
have
yeah.
to call the roll?
we do. Thanks for the reminder. So any motion to adjourn?
So moved.
Second.
Great. So then real quick, Amy Costello,
Yep.
Representative Murphy,
Yes.
Dan Tizik,
Yes.
Mindy Mesmer. Unmute.
Sorry, yes.
Thank you. And Katie Bush.
Muted by accident.
And Katie Bush, yes. Thanks, everyone. I agree. It was a really worthwhile conversation. We have our work cut out for us, but it is good to feel like we're making progress.
Yeah.
So thanks, everyone.
Thank you.
And we'll talk in just a
Thanks,
couple weeks.
Katie.
Have a great Thanksgiving in the meantime. Yeah.
Oh, you
And we'll
guys too.
reconvene.